And right, it's time to talk healthcare. You could be about to pay more for your child to see a doctor, and some kids could miss out altogether. 1,000 GPs and urgent care clinics across the country are sounding an alarm bell this morning, saying the government funding is not keeping pace with rising costs, and free visits for under-14s might need to be scrapped. Joining us this morning, Dr. Angus Chambers, the General Practice Owners Association Deputy Chair. Good morning.
Kia ora.
So let's start with some of the services that might need to be cut back or scrapped or that aren't being fully funded. There's the under-14, free for under-14s. What else might be on the chopping block?
Well, I guess community services cards have holders have a reduced fee, so that's another area that people could opt out of the schemes to enable that lower fee. I mean, and then you've got all your kind of business as usual, which is people getting cervical screening and chronic disease management. The costs go up. People will potentially miss out because of that.
Okay, so let's talk about how this works. So your costs have gone up. You've said between 14 and 17% cost inflation. Why?
Well, I guess health is an area where there is a lot of costs, and a very big area is nursing costs. With the District Health Board settlements with their nursing teams, the difference between, if the pay equity claim goes through, the difference between wages will be close to 30%. So there's extreme pressure there. There's a lot of staff shortages around the country, certainly doctors, but also our nursing teams and reception now. And so the pressure is going on wages as well.
Right.
Medical supplies, there's increasing costs in there. So all through the business, you look, there's cost increases.
Okay, so you've got these costs increasing, you say, for GP clinics between 14 and 17%. And then on the other side of the ledger, you've got what the government gives you for these services, like free under-14 healthcare and, as you say, the childhood immunisations. How much is the increase you get for that? Is it keeping pace with your costs?
Well, there's a kind of a formula that's used to try and anticipate increased costs, because the government clearly would like to keep patient fees down. But this year, the formula delivered, in the last 12 months, a 2.78% increase.
Okay, well, that doesn't sound very good.
Well, we've the GenPro has challenged the formula, and the District Health Boards and Ministry of Health actually agree that the formula is not fit for purpose, but they've declined to do anything about it.
Okay, so now doctors, GPs and urgent care clinics are left in this position where you're trying to make up the shortfall and you're trying to balance the books, right, so that you can keep the healthcare happening. At what point do they say we can't keep doing free for under-14s, and are they allowed to stop offering that service?
Yes, well, the free under-14s is an opt-in service, so you are allowed to opt out of it and go back to the situation that was there before free under-14s. So I guess it's a business decision, and I think no one would like to do that, because we all value the health of our children so much. But I guess it comes down to calculations in the end. And if you're losing money on providing a service, you have to think carefully about whether you can continue doing it. I think you mentioned childhood immunisations. We significantly lose money on childhood immunisations, but I would be surprised if we stopped doing them, because we're very big believers in immunisations and have been for a long time. And
sure.
So some of the things we will continue, because we'd like to think we're ethical as well.
Okay. Well, we'd like to think you are too. But there will be some people watching this morning, Dr. Chambers, who might be thinking, well, those doctors, they drive around in flash cars. Are doctors creaming it? I mean, do they have huge profit margins at these GP clinics and these after-hour clinics?
Well, look, I'm not privy to everyone's business arrangements, but I'll say there'll be some people doing reasonably well, but some people are not well at all. And, I think you've got to understand that the pressure on the workforce is quite intense, and there's competition throughout the world for staff. So there's very high pressures on the wages in that sense. But also we're in some of our rural areas where there's small practices without a lot of support, and in our lower socioeconomic areas, people will be really struggling, and there's a very, very big difference between the wages of general practitioners and hospital doctors.
Yes, which is an issue, I think, for another day, but one well raised. Thank you very much for your time this morning. We appreciate it. General Practice Owners Association Deputy Chair, Dr. Angus Chambers.